So you mentioned other countries. Who do you see as handling it the best, or the
Uh,
most effectively? Maybe is a better word.
South Korea.
South Korea, of course.
Um, they actually learned they had a outbreak of a similar virus, I think, last year or the year before, of SARS, which is like another respiratory infection, and the way they responded to that outbreak was sort of fairly poor, but they learned from it and they developed these really advanced and complex systems that could help to signpost people to the best services and to keep them clear of places that might have an increased risk of catching it. So they set
Mhm.
up they set up apps and things like that where when someone developed the disease, they would track where they'd been from
Mhm.
there before that, and then highlight that to people that, by the way, someone that has this has passed through these areas. If you
Mhm.
pass through these areas, let us know, and we can, we can map the spread of what's come in, and we
Mhm.
can sort of try and catch people before they start showing symptoms. And
Would
then
you say? Sorry, would you say with those apps? Would you say they are effective enough um, in, well, one, tracking the disease and also just fighting the disease? Because there's been a lot of um, kind of people scared about the whole privacy aspect of it. Do you think it's effective enough that we should give up that kind of? Um,
I mean, look at however many thousands of people have died from this, and there's always going to be the cry of is this infringing on our rights? But 20,000 people have been killed. But is it 20,000?
well, we're close to 30,000 now in the UK.
Yeah, have been killed by this disease, and if you can't sacrifice a bit of monitoring where you're going, then I feel like I personally think, yeah, sure, why not? I've got nothing to hide. You know, I'm fine for people to watch me go to and from Tesco every day to get a meal deal, and they're happy to take that information. But some people might not be happy with it. The South Korean government put it into place. I think they made it pretty much mandatory, and you can just look at their numbers, how well they have responded to it, and how low all their cases and deaths have been, and how
Mm,
quickly they sort of flatten their curve.
right.